Clozapine is an anti-psychotic medication that is used in treatment of schizophrenia. Now, it works by antagonizing the serotonin and the dopamine receptors. Now, it also antagonizes the muscarinic and the alpha adrenergic receptors. And here we will talk about the three most serious side effects of this medication. So starting with the first side effect, and that is the agranulocytosis. Now, agranulocytosis is severe decrease in the number of the granulocytes in the blood. And the granulocytes are the neutrophils, the basophils, and the eosinophils. And those are the white blood cells that are circulating in the blood. Now, the granulocytes are produced by the bone marrow, and clozapine has a suppressive effect on the bone marrow, so that is why it leads to agranulocytosis in 1% of patients taking this medication. And granulocytes function is related to immunity and fighting infections. So once their numbers decrease due to the suppressive effect of the clozapine on the bone marrow, then there is a higher risk for infections, and when infection develops, it would manifest as fever, rigor, sore throat, respiratory related symptoms if the infection is pneumonia, and urinary related symptoms if the infection is UTI, and it may manifest as sepsis. Now, risk factors for developing agranulocytosis while taking the clozapine include the female gender and the old age patients, and concurrent treatment with other medications that lead to agranulocytosis. Now, moving on to the second side effect, and that is the gastrointestinal hypomotility. Now, the gastrointestinal hypomotility is decrease in the contractile forces or a slower transit of the gastrointestinal tract, and this will lead to constipation, which is passing fewer stools, or it would lead to fecal impaction, and that is where a mass of feces would block the colon or the rectum due to the lower contractile forces and the slower transit of the gastrointestinal tract. Gastrointestinal hypomotility may also lead to paralytic ileus, which is paralysis of the ileum, which is the distal part of the small bowel, or it may lead to bowel obstruction, acute megacolon, ischemic bowel, or necrosis of the bowel. And the gastrointestinal hypomotility is caused by the anti-muscarinic effects of the clozapine. Now, regarding the third serious side effect, and that is the myocarditis. Now, myocarditis is inflammation of the heart muscle, and it occurs in 3% of cases. And myocarditis manifests as chest pain, shortness of breath, edema, which is swelling of the extremities, especially the lower limbs, or it may manifest as palpitations or fatigue. Now, risk factors for developing myocarditis while taking the clozapine include rapid titration of the clozapine and concurrent use of the selective serotonin reuptake inhibitors with the clozapine and illicit substance abuse. Now, all the three side effects mentioned already are serious side effects, and they may be fatal. Now let's talk about The other side effects of the clozapine, which include the hypersalivation, and hypersalivation is not a serious side effect. It is the most common side effect. It occurs in 60% of cases taking the clozapine. And clozapine also leads to weight gain and high blood sugar levels due to the serotonin antagonism, and it may lead to postural hypotension and palpitations due to the blocking of the alpha adrenergic receptors, and clozapine may lead to elevated temperature, sedation, and urinary retention due to its blocking of the muscarinic receptors.